Climate change has a cascading effect on all aspects of healthcare. Climate change can amplify risks in the way of heat, which directly can cause harm through heat stroke or cardiac arrest. And then beyond that, climate change is also changing our weather extremes. Extreme events like floods or hurricanes can change everything from the demand on our power grid to people's ability to actually access healthcare or get to the hospital. All of these different extreme climate and weather events can also directly impact human health through the toll they take on stress. Mental health outcomes are also exacerbated by climate and weather disasters. All over the United States, we see evidence of opioid overdoses going up during things like heat waves. We see acute mental health issues during hurricanes and winter storms. There are many different confounding factors here, of course, but climate change is a threat multiplier when it comes to human health. So our center, which is generously funded by the Burroughs Wellcome Foundation, has the goal of trying to pinpoint exactly how we can intervene, because we already know that poor air quality and climate change and weather extremes will have detrimental impacts to the health, especially here in Houston, where we have every type of climate and weather disaster. What we want to study is how can we educate the public? How can we intervene in a timely manner? How can we get timely warnings to people to prevent hazardous flood conditions from affecting their health care? We're going to be working closely with people like the Houston Health Department and Harris County Public Health, folks over in the medical center who are going to be doing things like monitoring viruses in wastewater. They're going to be looking at mosquito populations across the city. Where we come in natural sciences and the faculty that we have here at Rice is that we're going to be really helping to build those predictive models. If we have high heat for 2 weeks in a row over some threshold, how will that affect the mosquito populations in Houston? If we can take our drone surveillance of standing water all over the city, can we look at how mosquito populations change over time? We're providing the critical information that's needed to tie the climate and weather extreme information to those health outcomes.
The collaboration is going to be incredibly exciting. There's a really important piece that has to do very directly with infectious disease and its relationship to climate factors. What we've learned is that so many things happen or don't happen based on how well people can kind of access information, communicate about it, and make some difficult decisions. That means being able to communicate within a university, widely across disciplines. It also means being able to talk to a lot of different audiences, different publics. We're really excited to bring in postdocs, to fund graduate students, and to fund undergraduate students. And the big theme there is, how do we construct genuinely cross-campus multidisciplinary teams? We're actually really excited to think about that because it has everything to do with what it means to train our students, to retrain ourselves for the things that we need to be doing now, but also for the future.